the recording. Okay, so, good afternoon and welcome. Welcome to all of you. This is a series of 5 roundtable organized by the Dicastery for Promoting Integral Human Development and its partners. So today we have also with us experts from the Caritas Confederation and the Global Water 2020 initiative and also others. So we will soon hear from them, including religious congregations. So today, a Daughter of Charity and also an Italian NGO, Quam Doctors with Africa. Our meeting is being recorded and later we will have a time for question and comments. This said, do not hesitate any moment to write into the chat who you are, where you are from, your organization of affiliation. It will always be easier to understand who is who in the room. And also, you can already now or later write your question or comments, even if I will invite panelists to address them only later. Without further delay, I ask, please, if we can display a first welcome message, including excerpts from 3 Catholic voices. This has been recorded during the months of March. Please, let's go.
Access to water and related hygiene and sanitation should be a cause that unites the whole human family as behind a universal priority. Nowhere is this need more critically felt than within a healthcare facility, especially in a labor unit and in a delivery chamber. None of us, my dear friends, will wish to receive health care in a hospital or a clinic without clean running water, without toilet facilities, and without soap or disinfectant. Yet, nearly 2 billion people worldwide have no choice but to receive health care under these badly compromised conditions.
As someone who ran a children's hospital for 10 years, I can tell you all the medicines in the world will not keep children healthy without access to clean water. Without clean water, there is no possibility of adequate health care. Not to have clean water when people are most vulnerable increases the risk to their very lives. This is not a new problem, and it has been a cause of the spread of diseases, as well as the inability to get them under control. We must challenge a world that can create systems to live in space, build high-tech machines and buildings, but does not put that same genius to work, providing clean water to millions dying for lack of it.
Access to good health and hygiene depends on access to clean water. This is also among the most important lessons we have learned from COVID-19. Improved sanitation has significant impact not only on health, but also on social and economic development, more particularly in developing countries. We could also drastically reduce child malnourishment and help alleviate physical and mental underdevelopment. Deliver resilient water and sanitation services and be part of the change needed to leave no one behind.
We must not be patient, as the lives of children and families are threatened and consumed by the daily challenge to find clean water. Never mind that even in their healthcare facilities, they are not assured of clean water.
Getting sustainable wash in healthcare facilities a moral call. Again, welcome in this roundtable. Monday, we had the first roundtable of the cycle. It was presented in the context of the Laudato Si week. So the dicastery decided to give as much visibility as possible to this important issue. We have seen in this brief recording the commitment and the expertise of a sister, Sister Carol Keehan. I also see that many sisters and religious congregations are represented today. And also welcome then to all the sisters, brothers, and also ladies and gentlemen representing Caritas organizations and other groups, including we can see um, Aqua Reach and the parish twinning programs of the Americas. One of the congregation that has worked a lot with the dicastery in recent months are the Daughters of Charity. I have the pleasure to introduce Sister Marie-Louise Stubbs, so daughter of Charity of Saint Vincent de Paul, so one of the congregation that have worked with us. And you are also the executive director of a special team, the Daughters of Charity International Project Services, so based in the US, but with a good knowledge of all the initiatives of your congregation all around the world. Sister, please, you have the floor.
Thank you, Tebaldo. I come today as a messenger. I've been a daughter of charity for over 50 years, and my life is totally dedicated to the service of people suffering from poverty. My ministries in the past have been in hospitals, community health, and in the development of collaborative systems to address complex issues. Currently, as Tebaldo said, I serve with the Daughters of Charity International Project Services and work with our sisters in about 70 low-resource countries in order to help them find the resources they need to do projects which they've identified will improve the lives of those they serve. My experience in IPS over the past 8 years has brought me an emerging awareness. And emerging is something that I think we all need to work toward, of water and sanitation issues that impact health. So 8 years ago, I was aware of poverty issues in this country, in the United States of America, but the daily problems of the rest of the world were just a blur for me on the evening news. I never thought through the implications of lack of infrastructure because my experience was in modern hospitals, community health, social programming, all of it in a very privileged country when I look back at it. However, over and over, my office is receiving requests from communities served by our sisters for the most basic and rudimentary needs. Gutters and tubs to catch rainwater for schools, shallow wells for water gardens that they need for food, cisterns to store water for clinics, and pit toilets to reduce outdoor defecation. We've been putting patches on these problems one at a time. We've come to realize that a better approach is needed, so we began to coordinate with professionals who could assess the situations and then assist in developing water and sanitation systems. Now, these are not fancy, but they are effective and locally sustainable. It all ties back to basic health practices. and to community health with this combination of awareness, involvement, collaboration, occasional assistance when needed, and ongoing maintenance. The results of this approach can be monitored and are sustainable. Now, the solutions do have some complexity, I admit, but they're basically simple because as developed countries, we have the access to the knowledge, the expertise, the guidance of groups like World Health Organization, UNICEF, and others. And we have access to the relatively small amount of money which is needed to invest in getting a return of reduced illness and reduction of preventable death for millions of people. When we go in, the local people have the cultural competency, the willingness to work for improving situations, the skills needed to maintain the systems that are put in, and an investment in the lives of those they love. Thus, with our global awareness, we know that whatever happens in one small corner of the world will eventually impact us all. So, what are these simple steps? First, increase our awareness, both about where the needs are and about who can bring the technical assistance and the monetary support that is needed. Second, systematically start to identify water and sanitation problems and their solutions in both new and existing healthcare facilities. Third, develop collaborative links between healthcare facilities with their communities and with funders and the experts. Fourth, make the improvements and then prepare the local people to maintain the systems and to teach their communities about the importance of clean water and adequate sanitation. Finally, tell this story to others. Invite them to help. Believe me, we can do it if we do it together. Thank you.
Many thanks, Sister Marie-Louise. Thank you to you and all the sisters with us. I greet then representatives from Malawi, Kenya, Burkina Faso, Nigeria, Cameroon, the Netherlands, the United States, and I see also the French embassy to the Holy See. It's wonderful to see that this WASH in healthcare concern can unite so many of us. I will now briefly present the genesis, so the origins of this initiative. Everything started in 2018 with a major conference hosted in a pontifical university in Rome, organized by the Holy See. Well, you should know that the Holy See already many years ago started to address the water-related challenges. And in 2018, we had that international conference on the management of water as a common good. Two outcomes. The first one was a document, and the document is titled Aqua Fons Vitae, and it has been released last year. The second outcome was the desire to do something in this specific niche, this specific gray area between WASH and healthcare. So we studied with the help of several experts, including the Caritas Confederation, we studied the feasibility and the opportunity of having an assessment of a sample of healthcare facilities of the church. In August last year, Cardinal Peter Turkson, the prefect of the dicastery, sent a letter to all the bishops' conferences. So one letter to each country where the Catholic Church has bishops, inviting them to address WASH-related issues in healthcare and also in schools, where we understood that there was some interest, some availability to address further this issue. Then we invited the local church to do this assessment. And then we had a very interesting diversity between small dispensaries and hospitals, healthcare facilities in urban settings as well as in rural areas, healthcare facilities belonging to congregations or to dioceses. In some country, we assessed only a couple, in other country, many. So the idea was to have an understanding of what is missing, which are the challenges. If you can start by studying a problem, maybe you will understand how you can address it. And several times, those healthcare facilities had not performed any detailed survey or assessment about WASH in the last 5 or 10 years. So they were really quite interested in this initiative. But I will stop now for the moment and give the floor to George Wambugu. So George Wambugu is a representative of CAFOD, which is Caritas Organization for the United Kingdom. He is an officer in charge of emergency response. He is based in Nairobi, Kenya, and in the context of Caritas Internationalis, he is also the chair of the WASH working group. So please, George, could you present us the results of the assessment that took place in the last months? You have the floor.
Thank you very much, Tebaldo, and greetings from Nairobi. Let me share my screen. Yeah, yes. Again, good morning, good afternoon. As Tebaldo has introduced me, my name is George Wabogo, working with CAFOD as an emergency response officer and chair of the CI WASH working group. We were invited as a working group by CI to support in the, especially in the cost estimates of this program, and I supported in Malawi and Kenya, and my colleague also from the WASH working group supported in South Sudan. So the assessment was analyzed with the help of the group WASH, Water and CRS, and with Caritas Internationalis helping with, as I mentioned, with cost estimates. To present the findings, looking at some of the data globally, we have in these developed countries, 5 in 10 health facilities lack basic water services. 6 in 10 healthcare facilities lack basic sanitation services, and 3 in 10 healthcare facilities lack hygiene services. Now, with the assessment that Tebaldo has just detailed about, a total of 140 assessments were made. Some of the facilities had already made their own assessments, and so the total for all is 151, but the ones that were made, our reference to here is 140, and these are the people that are assessed the facilities, 28 million, and this was done in 23 countries. So you can see the hospitals were 19 and non-hospital were 81%. The data was collected in December 2020 to February 2021. The assessments taking about 45 minutes. The countries that participated in the assessments, as you can see on the screen, sorry. Albania, Angola, Burkina Faso, Cameroon, DRC, Ethiopia, Ghana, Haiti, India, Kenya, Malawi, Mali, Nigeria, Peru, Philippines, Senegal. We had South Sudan, Tanzania, Thailand, Uganda, Zambia, and Zimbabwe. So the results of the assessment, the definition of basic water is by JMP standards. And so improved water source is where there is piped water, rainwater, borehole, or protected dark well. So a protected water source. And where water is on the healthcare facilities. And also the assessment was also looked at water availability at the time of the survey. So for basic water service results, so 63% of the facilities lack basic water services. And you can see in the catchment of 2.4 million people in a zone with a health facility that provide basic water service. So 25.7 million lacking that. It was also looked at availability of water at that time. So 15% of the facilities said water was unavailable from the main source. And these are the populations that are accessing those facilities. So you see 22.7 million, of people are in a zone with health facility where water was not available at the time of the survey. Sorry. Where water is unavailable 1 day per week, these were that 7 facilities have no water at least once a week on average. And of these 67% of those facilities, they have delivery rooms, and 42 babies born per month on average. And so 21 million people are living within accessing those facilities. So this is a quote from one of the hygienists working in the facility, healthcare facility, and you can see that they are getting water from a hard pump that is outside of the facility to bring to the facility. So the hygienist goes every morning to the well located more than 500 meters from the center to fetch water with cans. This was in Mali. So the definition of basic hygiene services is a hand washing facility with running water and soap or sanitizer at point of care. And water and soap being 5 meters from the toilet. So with the basic hygiene services, the resorts, 53% of facilities lack basic hygiene services. So you can see there are 22.8 million people in a zone with health facility which lack basic hygiene services as compared to only 5.3 that access. So health workers are not able to routinely wash their hands due to insufficient water. That was a quote from the Democratic Republic of Congo. So the definition of basic sanitation services, toilets for patients, facilities available, functional and private, accessibility for people with limited mobility, staff toilets, latrines, toilets being sex separated, and at least there's menstrual hygiene management. At least some toilets are equipped with facilities for menstrual hygiene management. the basic sanitation resorts, quite dire. 90% of facilities lack basic sanitation facilities. And you can see catchment area of those facilities, the number of people that lack. So 27.9 million people are affected with our basic sanitation services. Only for that 413,000 have. Where pregnant women are expected to bring water for delivery. So 15% of facilities, they bring water. And in those facilities, one baby delivered each day. And 7 countries were affected. And just to think about the amount of water that is required for delivery by WHO standards is 100 liter of water per delivery. This 22 UK gallons and 26 American gallons, which is the size of a bathtub. So quite a huge amount of water that is needed for that. So where running water and the soap are not available in delivery rooms, 20% of the facilities. And again, one baby delivered each day. So 11 countries were affected. So when it comes to budgeting for WASH, 47% of our facilities assessed did not budget for WASH, and this was in 17 countries. For COVID-19 adaptation resorts, 84% of facilities have made improvements to WASH facilities in response to the pandemic. That came from the assessment. So for the facility cost estimates, a total of 151 facilities participated in these assessment or this endeavor. But estimates based on 108 facilities, it shows an average facility request of $64,643 US dollars. So the estimated funding needs for the 151 facilities based on the average is 9,761,000. So, and the catchment area of these facilities is 28 million people. Now, specifically, if we take, if you look at one of the countries that was assessed, looking at Kenya, the total assessed countries, total assessed healthcare facilities were 29, with 10% of them being hospitals and hospitals being 90%. So 7 of the 10 facilities lack basic services in water, and 4 of 10 facilities lack basic services in hygiene, and 8 of 10 facilities lack basic services in sanitation. So the total requested funds from Kenya was approximately $2 million US dollars, and average request for facility is $82 million, and that's the catchment assessed facilities reach is 743,000, approximately 743,652 people. So thank you very much. And these are the contacts. If you would want to get more information, and this slide will be accessible for sharing. Thank you.
Thank you very, very much, George, for this detailed presentation. This is a good vision, a good understanding of the challenges faced by this sample of healthcare facilities. But be careful where the directors of those facilities or the bishops or the local caritas themselves ask to be part of the assessment. So it is not a snapshot of the overall situation of the healthcare facilities of the Catholic Church on global level, but only a snapshot of areas in need of challenging situations where precisely the local people in charge ask to join this assessment. And in some circumstances, it was not easy. So even having the mere assessment filled and returned in a few circumstances, it required technical support by phone or even experts traveling from one diocese to another to help local sisters, local doctors to have this document properly compiled. I have seen a request in the chat box to show the Haiti slide. So if George, you can have it ready, we will share it later in order to uh, satisfy to this question. But for the moment, I propose we move on with the agenda and then give the floor to two kind of feedbacks from different perspectives after we have shared these results. And again, thank you very much, George, and all the team that made this assessment possible. So we have with us Josiane Sluijs from the Netherlands. So she is the managing director of a Dutch non-profit called Aqua for All, which is quite present in international meetings related to water. So I invited her to give a few comments on her point of view on this situation, on these challenges. Josiane, I didn't have the time to greet you earlier, but good afternoon. Thank you for being with us. You have the floor.
Thank you so much, Tebaldo, for inviting me to this very important roundtable. I'm going to kick off immediately. So what I want to reflect on first is I'm going to zoom in to a very specific area in Ethiopia and then zoom out again, because I think that if we need to find solutions that are so rightfully pointed out in the presentations that we just listened to, we need to think in solutions rather than only identifying what the current situation is. So what I wanted to share with you is something in the current context of the COVID pandemic. So what we did within our foundation is looked to water suppliers that we work with in the many countries and also in Ethiopia. And so over a period of time, we thought like, you know, in order for water suppliers and utilities to be able to continue to supply water, we need to set up a response facility, because there's of course a lot of pressure everywhere, but not having access to clean water is something that we as a foundation find very difficult to see. And so what we did is we talked to a few other foundations and supporters, and we compiled a response facility that water suppliers could apply to. What we quite often see with the companies and the entrepreneurs and the water suppliers that we work with is that there's not a 24/7 supply of water, and therefore you need water tanks. So what we did in the areas that we operate in is we also looked at, you know, what is happening in our surroundings that is water related, not necessarily focused on the core of our organization. It didn't really matter. So our person that is working in Ethiopia had a very close look, and especially to the quarantine centers and the healthcare centers in Amhara region where we operate. And what he noticed is that in many of those cases where universities and government buildings were transformed to quarantine centers and also at the healthcare centers themselves, only once a week there was water. And there was so limited availability to have access to it on a more frequent basis. So there was a huge need to have additional storage tanks available. And so what he did is made an inventory of, what is the situation on the ground. And even then, it was, I mean, it's not rocket science. So we need to give that special attention that in those times, it becomes extremely apparent. It exposes a problem that is structurally out there. And that is, that we still need tanks for storage. And if it's not there, it is a huge problem. And so I'm going to zoom out now because we exposed a problem that is already out there on a structural basis, but that became very apparent in COVID context. So this example doesn't only show the pressing need for access to water, it exposes a problem that we discussed also with the Minister of Water. And there is a very dedicated Minister of Water, and there's a thought through policy in place, the One Wash National Program in Ethiopia. But that comes at a price. And the funding for that One Wash National Program is simply not there. So in addition to what we are able to cover with the limited resources out of the response facility to buy tanks or to pre-finance water utilities for them to distribute filters for houses, for healthcare centers, etc., etc., we also talked on a more structural level with the minister. And what we agreed is that we're going to work more dedicated on a market-based approach. And that helps him solve part of his problem because we understand very, very well, of course, that not in all the situations you can use a market-based approach to solve access to water and sanitation solutions. So what needs to be done from a humanitarian perspective needs to be done from that perspective. But we must not forget that many of the solutions also lay in a more economic approach. In our day-to-day work, we see that many of the water operators, they earn a living by doing this. And they are able to, for example, go to a financial institution and borrow the funding, even maybe at a reduced rates. There are all kinds of solutions towards this. And be able, out of the earnings of the money of the water selling, to be able to pay back that specific loan. And so we set up a specific program with the ministry. And it's not only that we do this, how can you work on products and services that people can then acquire? Of course, there is also a need for funding to do this. So in parallel to this market-based approach, we also understand that the microfinance institutions and the banks must be able to borrow for these kind of situations. And so with the European Investment Bank, we're discussing currently if they can, together with the Minister of Finance, allow financial institutions to have liquidity to push in the market for entrepreneurs or utilities to pre-finance or to finance these kind of solutions. So zooming in Ethiopia, we see and we talk to the quarantine centers and the healthcare that there's a structural problem that becomes very apparent. And when zooming out again, we see that there's a big need to make sure that more funding flows into this sector. And everyone around this table does, with combined efforts, we're not able to mobilize the amounts that we need to meet the targets that we jointly agreed under the Sustainable Development Goal number 6. And this is why we do not only look in the very, zooming in Ethiopia area where individual organizations require solutions, we also zoom out to understand what could be more global solutions towards this problem. And one of the things that we're working on is really to make sure that this market-based approach that could also definitely apply for, the situations that we are jointly care for very much are possible. So what we need for our sector is a 20-fold in capital to meet the sustainable development goals. And so the funding that we as a foundation have available, we put on the table, but very dedicated to making sure that the grant funding, the subsidies through the Ministry of Foreign Affairs are going to be leveraged. It should have a catalyzing effect to make sure that everyone is included. Thank you, Tebaldo.
Thank you very much, Josiane, for this enriching vision. And certainly, where possible, where there are the conditions to pursue this kind of solution, let's hope that this will be possible. Different feedback will be now from Giovanna De Meneghi. So currently she is partnership and advocacy manager with an Italian NGO, Doctors with Africa, QAM. Until recently, she served on the field in Sierra Leone and Mozambique, so with a good understanding of WASH situation in healthcare, since the Italian NGO QAM sends doctors or other staff to support healthcare facilities in Africa. Please, Giovanna, you have the floor.
Good afternoon and good morning all, and thank you, Tebaldo, for the invitation once again. If you allow me, I will share my screen with a brief presentation. So my feedback is going to be a bit different, just because I would like to raise the attention on the importance of working on WASH and having a sustainable WASH situation also during an emergency. So this is the reason why I'm going to talk about the experience of Doctors with Africa QAM in Mozambique. That is a country that has started to experience several and different types of emergency, starting from cyclones up to the attacks of insurgents in the northern province. So first of all, which is the situation in Mozambique? Mozambique, according to UNICEF, only has half of its population having access to improved water supply, and less than a quarter use improved sanitation facility. And of course, as Tebaldo was underlying before, there are differences between the rural and urban setting. But again, let's have a look briefly at Mozambique. This is Mozambique, and again, it is a new country, almost new country, because it has around less than 50 years of independence, as an average population age of 17.3, with a very low life expectancy and literacy rate. And those explain why it's is ranked a 180 out of 188 by the Human Development Index. As I was mentioning initially, Mozambique was hit by several cyclones in 2019 and 2020. And also in 2021, which have affected drastically not only the population itself, so causing plenty of deaths and displaced, but also affecting the system. It's a healthcare system, which also endangered the endemic situation of cholera, for instance, and diarrhea, which are water-related disease. And those are some of the effects that we have been seeing during the cyclone. Again, in the northern part of Mozambique, we have a very serious situation around internal displaced people that has started to move from the northern districts towards the southern one. So with a strong amount of people in crowding the facilities in the southern part. Why am I saying all of this? Because in this situation, we found ourselves as KUAM, but also as Ministry of Health, partner of the Ministry of Health, in a very tough situation, especially when it comes to wash at health facility, because we all know that having a strong wash system within an health facility is essential to prevent the majority of the infections that are normally prevented if there is a wash system, functioning wash system in place. However, this situation has started to become a bit worse. And again, those are some of the key requirements that we are all familiar with. So having a safe and sufficient water, basic sanitation, adequate management of healthcare waste, appropriate knowledge of application of hygiene, and adequate ventilation. During the experience of COVID, those situations have worsened also, and especially when it comes to have a health facility overcrowded by patients with a limited and adequate ventilation system. So again, just to go to the point, what I wanted to share with you was the importance of having a resilient system that works and that is based on a previous experience of coordination with the Ministry of Health and with a system that must be ready to receive a higher number of patients when there is the case. And at the same time, the other key component of KUAM's strategy in Mozambique, but also all over the countries, is a commitment and a work with the community health workers and the community health activists. Why am I saying so? Because having a sensitized population, having sensitized women and children, knowing basic hygiene practices and trying to work on them will definitely prevent at least as much as a population can do without the wider and a systematic approach with a government intervention in the limitation of the cholera cases, for instance, and the cholera outbreaks, but also to limit the access of patients arriving very late at health facility. So treating patients at community, trying to identify high-risk cases at community level in order to refer them timely is another essential activity that we're trying to do, apart from bettering the healthcare system with a technical expertise and rehabilitation unit. Over.
Thank you very, very much, Giovanna, for this very concrete, so human presentation. So education, resilience, awareness, and working with communities. Thank you for these strong pillars you shared with us and with your experience. So, ladies and gentlemen, again, it's a pleasure being with you in this roundtable dedicated to WASH in healthcare facilities. Delighted to be with the Spiritans, with the Aqua for All, with the US Catholic Medical Bureau, also with experts from UNICEF, USAID, and the University of Notre Dame. I have asked, and I repeat now, if some of you would like to raise any issue briefly, to ask a question, to write a comment, please use the chat box. In the meantime, I ask to George Wambugu if please he can share once again the slide on Haiti, since this was the request of one of our participants. And
yeah, let me share. Thank you. Let me get back
thank you very much, George.
Slide. Let me get to that slide. I'm sorry I didn't share Haiti because of interest of time. There was also Philippines, so the Haiti results were as follows: total of the assessed facilities were 10 hospital status 10%, non-hospital status 90%. And for basic water services, 4 out of 10 facilities lack basic services in basic water services. And for hygiene services, 5 out of 10 facilities lack basic services. And on the, in actually sanitation is quite dire because all the 10 facilities, they lack basic services. The total requested funding was 434, 699 US dollars. So average per facility 43,470. And the catchment for people that are for the facilities, it was 235, 361 people. Thank you. As I said, the slide will be shared.
Thank you very much, George, for this answer so precise on Haiti. So on my side, I would like to share the fact that earlier this week, the Laudato Si Action platform has been presented during a press conference in the press office of the Holy See. The Laudato Si Action platform, where now, let's say, registration is already open, will allow, starting from October, different actors, so including families, dioceses, NGOs, congregations, monasteries, and so on, to commit during 7 years of improvement in the spirit of the encyclical letter Laudato Si. So WASH will be a part of this platform, and also more generally healthcare facilities are also invited to join this initiative. This said, I have seen that Reuben Tor has raised a hand. Please, oh wonderful, you are in good company. Say hello to them from the Netherlands, France, Italy, US, many countries. Please, we can see you, we greet you, but we cannot. You should switch on your mic.
Okay.
Please.
All right. Good day, everybody. My children are saying hi too. Say hi. Okay. So sorry for joining late. I have had issues with the network, so I joined in lately. I am joining from the Catholic Diocese of Boko from Benue State, Nigeria. So I wanted to know if the situation for the Diocese of Boko has been presented, because we conducted the assessment and we sent in our assessment results and findings. But I was unfortunate to join lately, so I didn't know if our situation here has been presented and maybe has been discussed. Thank you.
Thank you very much to you, to all those children, and to your diocese, your bishop, and your team for joining the dicastery's initiative. We presented only a sample of situations with a very brief look on Haiti and a very brief on Kenya. So only 2 countries have been described out of 23. So only 2. This said, the dicastery now and its partners are looking for funding and for technical assistance for all the healthcare facilities that were involved in this initiative. So also for this diocese. So indeed, even if we haven't presented today in this roundtable your local situation, nevertheless, I confirm all the data, the shortages, the cost estimate have been stored, have been analyzed, and we are talking to donors and partners to support you, the local church, the doctors, the nurses and the chaplains in the most effective way possible. Thank you very, very much. Uh, they taking on more sites that lack the wash facilities. The answer is that for the moment, the dicastery itself is not promoting, will not, let's say, lead assessments in other countries or other healthcare facilities. Yet, what we would like to do is to inspire, to create those connections which may have been missing so far, and to give, above all, more visibility and a higher sense of urgency to an issue that maybe has been given for granted for a long time. Maybe that in OECD industrialized country, it is easy to have some kind of ideal vision of the work of sisters, doctors, nurses, and missionaries in areas in need. We have the feeling that they are doing a challenging yet wonderful task. We admire their commitment, yet maybe sometimes we do not understand that even the fundamentals, such as water, soap, toilets, proper filters, etc., so the basics for wash, may not be granted. So what the dicaster is doing, beside communication and facilitating partnership, is that we will soon share the tools we use for the assessment. So the assessment tool, and also the way you need to read it to understand your own score and results. What kind of challenges you should be able to fix by yourself? What kind of challenges need more technical support and bigger fundraising, this kind of issues. So by inspiring others, we hope that other dioceses, other caritas, other congregation will be able to undertake this kind of assessment and then start partnership in order to improve the situation. This will be done quite soon. Um, I don't see other hands. Um, I've been asked about the recording. So let's say the session which took place Monday the 24th, so the bigger one, multilingual, so in 5 languages, is already online on the YouTube channel of the Dicastery for Promoting Integral Human Development. Later, we will also share the recordings to the other roundtables of yesterday and of today. I will now invite our friends from Global Water 2020 to share a video recorded in the Philippines. So Father Dan Vicente is the executive secretary of the local commission on health. So from the Philippines, Father Dan Vicente Cancino.
The assessment done regarding WASH in our health facilities has revealed 3 important points. First, it was really a shock for us really to see the WASH condition in the different areas. The water and sanitation services is really deficient, all pointing towards a potentially overwhelming burden to contain really the virus.
We need really to focus our next steps on the adequacy of water availability. Second, the acceptability of water quality. The third would be water resource management must be increased and an affordable access to water, sanitation, and hygiene. I hope that this message, not coming from me, but really coming from these communities and from the hearts of all those people who are doing their best to stop the pandemic and to bring quality of lives to the community. We have been known a people of resilience and persistence. And we get that from our belief that we cannot do it alone. Impelled by the love of Christ, we can do it together. We heal as one.
Thank you very, very much for this brief testimony. So also for the Philippines, for several healthcare facilities, we are currently looking for support in order to address the situation. As I told earlier, this initiative started after a conference which took place in 2018. So at the time, none of us had heard about the COVID-19. Yet the ongoing pandemic gave more visibility to these WASH issues. This said, even if in a few years the COVID-19 maybe will disappear, WASH will remain a daily challenge, a daily need in all healthcare facilities, including obviously in schools and households. I will now give the floor to a representative of the initiative Global Water 2020 that has been a partner now already, dear David, since that conference in 2018. So David Douglas, founder of the NGO Waterlines and principal of Global Water 2020, has a long experience in this field. David, so thank you very much for being with us. You are the last speaker of our roundtable. You have the floor.
It is a privilege, Tebaldo, to be the last speaker. And it was wonderful a few minutes ago to see the photographs in the video from the Philippines and then firsthand from Nigeria. I'm speaking today from Santa Fe, New Mexico, in the United States, where I became involved with water, sanitation, and hygiene some 35 years ago, after being inspired by a Catholic sister, Sister Mary Joaquin of the Catholic Order of Sisters of Charity of Mount St. Joseph, Ohio. And she ran a small clinic in Mexico. And I think she would say, as so many other sisters that are involved in this initiative have said, that a hospital or a clinic cannot function adequately without safe water and clean toilets and a place to wash hands. And I once thought that this was an isolated problem in scattered hospitals and clinics. But as this and other roundtables this week have reminded so many people around the world that this issue affects 2 billion people in low-income countries. And access to wash is indeed the foundation, the bedrock of public health in worldwide. And on behalf of any effort on behalf of infection prevention control, antimicrobial resistance, maternal and neonatal health, and as COVID has made clear, pandemic preparedness and response. On this 5th anniversary, or 6th anniversary, it's not surprising to remember that there are 47 references to water in Laudato Si. And as Pope Francis wrote, water and sanitation for healthcare are issues of primary importance, and of particular concern is the quality of water available to the poor. Achieving the goal, the universal goal, or the goal of universal access to water will remain a pipe dream if those operating healthcare facilities cannot provide water to where the most vulnerable people gather, those who are not only poor, but also sick. It has been estimated that the Catholic Church operates as many as 25% of the world's healthcare facilities, and the significance of the dicastery's leadership in this initiative should be apparent to all. Cardinal Turkson's letters from Rome to bishops around the world, asking them to, quote, ensure adequate access for WASH in all healthcare facilities in order to safely treat patients, prevent diseases, and protect healthcare workers, has illumined the urgent necessity for Catholic-run healthcare facilities to take what steps they can to improve these basics of water, sanitation, and hygiene. That eloquent verbal call to action has been coupled to action on the ground, with the dicastery, as you all have heard, taking practical steps to improve WASH in a limited number of healthcare facilities that were the first to request help. Working with the Caritas Federation, notably Catholic Relief Services, and the international project services of the Daughters of Charity, Global Water, and others, the dicastery has taken steps to technically assess, as you have heard, and technically assess and direct funders to the WASH needs at those 150 hospitals in 23 countries, serving nearly 28 million people. There is work for everyone to do. Many of you who are listening to today's roundtable are already deeply involved in this effort. But if not, there are several ways to support this initiative. If you are connected to a healthcare facility, by assessing the adequacy of its WASH conditions, you may be in a position to help fund improvements at one or more of these healthcare facilities. Others of you may be in a position to speak, to publicize, to continue to illuminate the predicament for the world's health when half of its healthcare facilities lack adequate WASH. The problem is solvable. As Pope Francis noted at the height of the COVID pandemic last year, to emerge better from a crisis like the current one, each one of us is called to share the responsibility. Lastly, it should not be forgotten that this initiative is part of a larger movement. The dicastery's effort is congruent with a large global initiative to improve WASH in healthcare facilities, where heightened concern and accelerating action has been shown by the UN Secretary General, the World Health Organization, UNICEF, the World Bank, and literally hundreds of religious and secular implementing organizations. It is safe indeed to say that the dicastery's initiative is not only accompanying or complementing these other efforts, but it is inspiring other faith-based organizations as well as governments to improve WASH conditions in their own faith-based or government-run hospitals and clinics. The dicastery deserves great credit for bringing this issue to the attention of many Catholic communities around the world and responding to those who seek basic hygiene and sanitation, and those who thirst for safe water in many places, but particularly in the most vulnerable setting of all, a healthcare facility. So on behalf of many people, I say a sincere thank you to the dicastery.
I say a sincere thank you to all the partners that accompanied the dicastery in recent years, both, let's say, at the preparation and coordination level, as well as on the field with the assessments and the cost estimates and the training. It has been a pleasure to have this roundtable with representatives of so many technical organizations, religious congregations, governments, and members of the Caritas Confederation. Thank you also those who represented QAM, Medici con l'Africa, dear David, and the whole team of Global Water 2020. Thank you very much also for your participation, your support, and David, your final inspiring and encouraging words. So I once more thanks Sister Marie-Louise, George Wambugo, Josians Luiges, Giovanna De Meneghi, David Douglas, and the whole team of Global Water 2020 for their technical support during this roundtable. This is the end of our gathering. Do not hesitate to contact water at humandevelopment.va to continue this conversation.